Hello, my name is Erica Tugas. Welcome to my presentation about health disparities in minorities for IDS 400 at Southern New Hampshire University. I hope you will find this presentation informative and insightful. The definition of health disparities can vary depending on the source, but essentially they all mean the same thing. The National Institutes of Health defines health disparities as differences in the incidence, prevalence, mortality, and burden of diseases and other adverse health conditions that exist among specific populations in the United States. The Office of Minority Health defines health disparities as differences in the health outcomes that are closely linked with social, economic, and environmental disadvantage. The Commission on Social Determinants of Health, World Health Organization, defines health disparities as health inequalities that are considered unnecessary, avoidable, and unfair or unjust. There are many factors that contribute to health inequalities and disparities. These disparities occur across many dimensions and include race and ethnicity, socioeconomic status, age, location, gender, disability status, sexual orientation, and level of education, or, in most cases, a combination of all of them, a direct result of intersectionality. These factors often affect access to quality healthcare and health resources, proper nutrition, discrimination from healthcare workers, environmental hazards, and the inability to navigate the healthcare system, among many others. Now that we are aware of what factors contribute to health inequalities, we can take this knowledge one step further and determine who, exactly, is particularly vulnerable to health disparities. These groups include people of color, low-income groups, women, children, older adults, and individuals with special health care needs, and individuals living in rural and inner-city areas. Again, it is important to remember that intersectionality plays a big role in this. These groups are not mutually exclusive and often interact in varying degrees. According to the Matrix Reader, race and class interact together to contribute to health inequalities. It is beneficial to each and every person that we minimize the effects of health disparities. At the national level, health inequities account for an annual loss to the United States economy of roughly $309 billion. At the local level, health disparities rob individuals, employers, and communities of human resources and money. They drive up costs, decrease productivity, increase absenteeism, destroy morale, and diminish the quality of life for everyone. As the cost of healthcare increases, to make up for the excessive cost of caring for those who have delayed healthcare and now seek emergency care at a much higher cost, the burden is spread equally among the population. If we take a look at this infographic, we can learn more about health disparities that African Americans face. African Americans have a 40% greater risk than whites of having high blood pressure. As we know, hypertension leads to heart disease and failure, kidney disease, and stroke. African Americans are 2.1 times more likely to be diabetic and experience major complications due to the disease. Obesity is another factor that affects the health of African Americans. 37.3% of African Americans are considered obese. Nearly 50% of African Americans have chronic illnesses or are disabled. Another sad statistic is that the rate for African American infant mortality versus white infants is 2.5 times higher. Lastly, African Americans are 10 times more likely to have AIDS than whites. If we look more in depth at some of these alarming statistics, we see that African Americans experience over 8 and 10 times higher rates of HIV and AIDS diagnoses than whites. There are many factors that increase the risk of African Americans contracting HIV. These include the already high prevalence of HIV among African Americans, the stigma associated with being HIV positive, and various socioeconomic factors. African American males have the shortest life expectancy compared to other groups. According to the CDC, in 2010, life expectancy for the African American population was 3.8 years lower than that of the white population. This difference was due to higher death rates for African American population for heart disease, cancer, homicide, diabetes, and perinatal conditions. Infant mortality rates are significantly higher for African Americans, American Indians, and Alaska Natives compared to whites. This is due to higher rates of preterm birth and SIDS, as well as socioeconomic status. If we take a look at this infographic, we can see several different suggestions about ways to reduce health disparities in our country. The first recommendation is that affordable health insurance coverage is provided to all Americans. It also encourages promoting a diverse healthcare workforce, one that cares about issues related to health disparity and health equality. If we take a look at the third recommendation, we can see that we need to build more clinics in these low-income areas to make quality healthcare more accessible. It also highlights the importance of collecting and accurately recording data that documents racial disparities in care and screenings. The final recommendation is that we educate everyone about the risks and medical predispositions specific to their race. The goal of public health is to promote initiatives that will reduce health disparities in the United States. There are so many different initiatives already in place working to reduce the disparities. The CDC continues to have ongoing efforts to identify the leading causes of morbidity and mortality in order to implement programs that reduce and eliminate, when possible, these disparities. There are numerous provisions in the Affordable Care Act that address and attempt to mitigate health disparities, including expanding coverage and access to care, non-discrimination clauses, provisions to strengthen federal data collection, a community health center program, health professional opportunity grants, maternal, infant, and early childhood home visitation programs, community transformation grants, and promotion of healthcare workers. I have a few thoughts of my own about what can be done to reduce health disparities in our country. First of all, it is important for the public to be aware that this is an ongoing problem in our country and we cannot turn a blind eye to these inequalities. Secondly, I think that insurance companies can do more to prevent poor health in their clients. Ideally, insurance companies would be proactive, educating their clients about the benefits of wellness checkups and preventative care, rather than just seeing a doctor when they're very sick and disease has already taken over. Clients also need reinforcement about healthy behaviors. Health behaviors also pose a significant threat to health disparity each year. And lastly, nursing schools, as well as medical schools, should be encouraged and/or required to incorporate culture and diversity into their curriculums. Here is a great infographic that provides us with ways to be aware and reduce health disparities in our own communities. I encourage you to spend a few minutes to look over the information presented on this slide and identify ways that you can make changes, big or small, to improve the health and well-being in your own communities. Thank you for taking the time to view my presentation. I hope you have enjoyed it. and I hope you've learned something from it.